Hi, Dr. Yass here. In this video, I want to try to provide substantial evidence why I can make the statement that in 95% or greater cases of surgery related to pain, the surgery is unnecessary and baseless. Now, I've been on Reddit and gone into some of the subreddit levels for sciatica and back pain or chronic pain, and it is clear that people have been completely culturally brainwashed to believe that the magical herniated disc is the cause of their pain. It's absolutely stunning to me to see how emphatic people's view are, and when pushed to provide some sort of evidence that the idea of the herniated disc being the cause of the pain is real, there's nothing. There's nothing. In fact, I am considered to be a pariah because I'm promoting something other than that, which is the idea of how misrepresentation develops. There's a predetermined concept that is culturally based, not medically based, since the advent of the MRI and the identification of the herniated disc at the time of pain. And so people simply accept that. It's now 40 years down the road, and the failure rates relating to treatment of herniated disc and stenosis and arthritis are massive. New diagnoses were created by the medical system to identify failed back surgery syndrome. The opioid epidemic developed as a result of the chronic pain epidemic, and yet people are still willing to go along with this premise that these MRI findings of structural variations are legitimate. It's stunning. It's literally stunning to a person of my nature who is strictly a logician, who only knows logic and analysis. So I want to be very clear. I want to go through the three primary areas of evidence: theoretical, clinical, and scientific, just to show you that you need to disregard the use of the MRI. It's not just to question whether surgery is necessary, which even that premise of surgery as a last resort is a coerced position. The idea of getting you to believe in that concept is to coerce you into saying, well, when everything else fails, now I'm willing to get a surgery because nothing else worked for me. Well, what if theoretically there was no basis for the surgery? Would you still get the surgery if nothing else worked? So the idea is that you have a choice of doing nothing and knowing that's not going to work, or getting a surgery which is guaranteed to fail because there's no theoretical, clinical, or scientific evidence of it, but you still do it because you've been brainwashed, and everyone's been brainwashed. And I hate to say it, but even the medical practitioners promoting it have been brainwashed to believe there's some validity in this nonsense. And then when it doesn't work, there's this shocking, sudden awareness, oh my God, it didn't work. Well, it was never going to work. And in more than 95% of cases, theoretically, from the beginning, I could have told you it wasn't going to work. So let's just try to get into some of the aspects of this, and then hopefully it'll prevent you from going down this path. Once you have pain, you have to recognize that any attempt to use the medical system is based, I don't care if you're talking chiropractor, physical therapist, rheumatologist, orthopedist, neurologist, pain man, it doesn't matter. As long as your diagnosis is based on an MRI or X-ray finding, you are doomed to failure from the beginning. So let's first talk about the concept of how this works. Let's talk first theoretical. The theoretical premise of the use of the MRI is that suddenly you had this ability to see these structural variations: herniated disc, stenosis, arthritis, meniscal tears, spondylolisthesis, compression fractures, all these things. And the idea is that, wow, it's identified for the first time at the time you're having pain, and therefore it can be asserted to be the cause of the pain. That is the basis of the global use of the MRI in the medical system's promotion, that these things are causing your pain. They're identified for the first time while you're having pain, therefore it is the cause of pain. This is known as correlative theory or junk science. This idea of asserting since one thing happens at the time of another, it is the cause. So for instance, if I open my front door when the sun rises, I can say opening my front door causes the sun to rise. Clearly an insane position, but it is the basis of correlative theory. So if we're looking at the body, I would propose that the MRI would show at the time you're having pain that you have two elbows. So I can therefore assert, since you have two elbows at the time of the pain, having two elbows is the cause of your pain. So you should have your elbows removed. Now you laugh every time I promote this and present this. People laugh and say, that's ridiculous. Well, it's no less ridiculous than the idea of saying, since a herniated disc was found at the time you have pain, it is the cause. We can go on and look at the idea. People have to understand there's a basis of science, and science must be followed for anything to be of value. So the hypothesis that's being proposed is that herniated discs cause pain. That is what is proposed by the use of the MRI. Well, for every hypothesis, there's a null hypothesis. So for the hypothesis to be true, the null hypothesis has to be true. That is to say that if you want to say that herniated discs cause pain, then what must also be true is that in those people who don't have pain, there should be no herniated discs. Well, by 1994, the first studies on people without pain found that 70% of the population who don't have lower back pain have bulging or herniated discs. It went farther that later in the years, they did studies on people over the age of 60, and it was found that greater than 90% of people over the age of 60 with no lower back pain were found to have bulging or degenerative discs. So clearly, the null hypothesis isn't matched, which then says that the hypothesis can't be true. This is just straight science. There's no confusion here. This is fact. You have to have the hypothesis and the null hypothesis be accurate for the hypothesis to be true. In this case, since people without pain do have herniated discs in the same percentages as those with pain, it can now be said that the idea of herniated disc causing pain is a fallacy. Okay? So that's the first concept. And then you just have to try to be a little logical and say to yourself, well, as I'm aging, I'm going into my 40s and 50s and 60s. Maybe I've had a physical life. Do you think it's confusing that in the highest percentage of people, a herniated disc or arthritis or stenosis would be found? Doesn't matter if you're in pain or not in pain, if you're 6 foot, 5 foot, blonde hair, blue eyes, it doesn't matter. Would you be surprised to find that structural variations have developed over time? And the answer is quite clearly yes, of course. Of course, because you didn't know how to strengthen and achieve balance of muscle to sustain the appropriate positions of the joint surfaces to maximize the ability of gravity to push through the joint surfaces perfectly, thereby preventing deterioration. You didn't know about that. So of course, the world's population is developing structural variations. And certainly since the 1980s, with the advent of technology, there's lesser use of muscles, therefore there's greater variations in the way the muscles can support the joints and allow the forces to run through them properly. So that's why you're going to see greater levels of structural variation, along with increased levels of pain. So if you know that it's not surprising that older people, as time goes on, have structural variations, why is it this shocking moment that these structural variations are found while the person is having pain for the first time? You don't think that if the MRI was taken before the pain, these structural variations would have been found? Of course they would have. It's obvious. It's obvious. So this scam of trying to coerce you that it's the cause of pain just because it's found at the first time is complete insanity. I could say strong-sidedness, being right-handed, is caused by herniated discs. And sure as shit, if I was to take an MRI of a shitload of right-handed people, I would find 80% of them have herniated discs. Does that mean right-handedness is the cause of that herniated disc is the cause of right-handedness? Of course not. It's an independent variable. If that were the case, then we would have to say left-handed people don't have herniated discs. And you would find that left-handed people have the same percentage of people having herniated discs as those as right-handed. Therefore, dominance in handedness is clearly independent. The same thing I just pointed out relates to pain. So, from a theoretical perspective, you have to understand that this use of the MRI is baseless. And I understand it's global. But it's your body. You're the one who's going to have to determine how you're to be treated. You're the one who's going to determine whether you're getting that surgery or not. And if you think that they're not standing there hoping that you're going to say yes, so you're just another person in a conveyor belt of people getting this stuff. And by the way, because it's a fee-for-service basis, they're quite happy if you don't get any improvement in symptom, because you'll just come back for more as long as you're willing, right? So that's the theoretical premise, that it is baseless. Let's look at the clinical premise, and that is to say that every tissue creates a specific symptom to indicate it is in distress. So for instance, we look at the heart. What is the indication of the heart in distress? Pain at the chest and the left arm. Look at the brain. What is the indication? Well, numbness or some lack of strength of an entire side of your body indicates a symptom of distress of the brain. So clearly this is the way it works. Well, when we look at where symptoms are being experienced, and God forbid any medical practitioner would ever consider symptoms, they don't, it's all completely ignored. You're in a doctor's office less than 2 minutes to find out where your pain is so they can give you the prescription for the MRI for that location. But you have to understand there is a direct correlation between the symptoms being experienced and the tissue in distress. And what I have found, quite simply, over 27 years, heading almost to 3 decades of evaluating people based on their symptoms, is that in more than 99.999% of cases, the area where the symptoms were being experienced were not where they should be if the structural variation were to create symptoms. That is an immediate disqualification of the structural variation as the cause of those symptoms. If the symptoms don't match up to the supposed cause that creates those symptoms, then the identified cause can't be the cause of the symptoms. It can't be any clearer. Crazy nonsense like pain at the kneecap coming from meniscus, a meniscal tear, or arthritis of the knee joint. Well, there's 2 joints. One is between the thigh bone and the lower leg bone. One is between the kneecap and the thigh bone. Some structural variation at the joint between the thigh bone and lower leg bone can cause pain at the joint between the kneecap and the thigh bone. They're 2 separate joints. And yet you just go along with it because they showed you the fancy picture and they're telling it to you, and therefore you think you should trust them. But facts are facts. There's so many. Pain 3 inches off the lower back, off the spine in the lower back. You're told it's from a herniated disc. Can someone explain how a herniated disc, which is centralized in the spine, can create pain 3 inches to the side? And some schmuck is going to tell you, oh, well, it's referred. Well, there is no referral pattern there. That's not the way it works. Certainly the disc can't create the referred symptom, and the nerve root coming out innervates in the lumbar region, innervates areas of skin in the leg, not in the back. So there is no path. There is no connection between pain to the left side of the back, of the spine in the lower back, and a herniated disc that's identified. You can see it in every joint. Pain in the groin, coming from the hip joint. The hip joint's on the outside of your leg. Most people don't even know where this stuff is. The hip joint's on the outside of the thigh, and you're having pain in the groin, and someone's telling you it's coming from the hip joint. It's just insanity. If there was an arthritic change or a labral tear in the hip joint, it's got to create pain at the joint itself. The joint can't refer symptoms. It's just not the way the body works. They want to say that. The medical establishment, certainly the orthopedist, will tell you anything. He'll tell you that pain in your eyelash is coming from your hip joint. If he can coerce you into getting a surgery, well, God bless, and you're willing to accept that. That's the system we have today. Right? So that's the clinical aspect. If your symptoms don't match where they should be, if a structural variation identified were to create symptoms, then the symptoms can't be being caused by the structural variation. Then there's just the huge level of scientific evidence, right? Which Like I had mentioned prior, in 1994, the first study being done on people without lower back pain, 70% have herniated discs or bulging discs who don't have the pain. 90% of people over the age of 60 who don't have lower back pain have bulging or degenerative discs. 63% of people with knee pain have meniscal tears. 60% of people who don't have knee pain have meniscal tears. All the surgical studies that have been done, crazy study, in the knee, arthritis causes knee pain. They get all these people who have been diagnosed with arthritis causing their knee pain. They break them up into 3 groups. One gets a debridement, scrapes out the arthritis. Another gets a washing of the knee. Another gets a mock surgery. And it's found out that there is 0 difference in the results of those 3 treatments on the effect of pain at the knee. And the conclusion is arthritis doesn't cause knee pain. Because if it did, clearly the debridement people would have, all those people would have no pain, right? The people who got the wash, I don't know to what degree that would help, but certainly the mock surgery, they should all be in the same boat, still having pain, and yet the results were identical. Whether you got the actual scraping out of the arthritis, the washing of the knee joint, or nothing. I mean, it's just overwhelming. The evidence is irrefutable scientifically that every attempt to treat based on these MRI findings has failed miserably. Just to bring up a really key point so that you know it's not just me, in 2007, the American College of Physicians does a position paper on the epidemic, the chronic pain epidemic, and they established that of people with lower back pain, 85% of them are found to have what is known as non-specific back pain. Their pain cannot be attributed to a structural variation. 85% of all people suffering from lower back pain fall into the category of non-specific lower back pain. 85%, right? Almost everybody. As a result of this, they conclude that the use of MRIs to find structural variations and identify the causes related to the structural variations has no improvement in outcome of treatment for the pain. No improvement. No improvement. Not a little, no improvement. And in fact, they suggest that the finding of these structural variations leads to unnecessary treatments and unnecessary costs. That's the American College of Physicians. You can look it up. 2007 position paper on the use of MRI for lower back pain. The evidence is clear. It's just that simple. Whether it's theoretical, clinical, or scientific. Now it's your choice. You see this video, you make the decision. If you want to follow the path of everybody else, good luck. I wish you luck. I hope things work out for you. But when that surgery fails, or they've got you down the line of prescription medication or epidural nerve blocks, well, you're going to look back and you're going to say, well, that guy mentioned that this probably wasn't going to work because there's no evidence that there's any validity in the use of diagnostic testing. But why go down that path? Why not just recognize what's clear and irrefutable? And if you think that you shouldn't believe me just because I'm a singular person, forget that. Listen to the information. That's what counts. Magellan was the only guy at the time who said the world was round and that you're not going to fall out off the edge. Was he right? Yeah. Copernicus said that the earth evolves around the sun, not the other way around. Was he right? Yeah. There's loads of people throughout history that saw something that was different but was proven to be correct. And science will always prove what's correct. So it's your choice. Make a decision. If this is starting to make sense to you and you want further assistance in helping you determine whether your cause is muscular and whether that this is the path to resolving your pain, you can contact me by email at drmitch at mitchellyass.com, drmitch at mitchellyass.com. If you like this video, please give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe so that you can get notifications when new videos are added. I try to add them as often as possible, or when I'm live on YouTube. If you want to make an appointment to see me so that I can do an evaluation to confirm what's causing your pain, and if it is muscular, help you do the right exercise to resolve the pain quickly and effectively. Again, contact me by email at drmitch@mitchellyass.com. I'll keep putting this stuff out. I'll keep making it available. I continually get contacted more and more from people globally, who are seeing that this makes sense and is an alternative to the existing medical system globally. Just remember, it's your body. It's your choice. You don't have to get a surgery when you even have suspected that it doesn't seem right, but you think there's no alternative. Trust me, there is an alternative. This is the alternative. The Yass method is the alternative. All right? For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.